Mpox.
A dangerous virus is rapidly spreading across the world, having already reached 116 countries, including the United States of America. The World Health Organization has issued an urgent alert warning that if the virus is not controlled immediately, it could become the next major pandemic. Just 2 weeks ago, on August 14, Dr. Tedros, Director General of the WHO, announced that the dangerous virus Mpox, once confined to a single country in Africa, is now spreading globally. This deadly strain of Mpox, a more violent variant of the virus first detected in 2022, has now become a global threat. A new, more powerful strain of the virus was detected, which within months spread to Central Africa, particularly in the Democratic Republic of Congo. Not only this, it has now spread to 12 countries in Africa as well as to Sweden, Saudi Arabia, the Philippines, and even China. Estimates show that this new variant is at least 7 times stronger than COVID-19. It is so deadly that cases have now been reported across multiple states in the United States. While we know viruses can spread rapidly, this one incubates in the human body for 2 to 3 years before becoming active. During this incubation period, the virus mutates, developing structures that can evade the immune systems of many individuals. After this time, a deadly variant may emerge, spreading rapidly among the public and causing fatality. Welcome to Midcast TV once again. Exactly 2 years ago in 2022, a less severe Mpox outbreak impacted 100,000 people globally. This means the virus had plenty of time to incubate, and now this variant is more violent than the previous one. So, is it like the COVID virus? Are we facing another global pandemic? How has this virus suddenly started spreading across the world? Do we have the vaccine for this virus unlike COVID? Well, in 1958, some scientists from Denmark imported macaque monkeys from Singapore to test their polio vaccine. When the monkeys arrived in Denmark, one was found to be infected with a severe virus, showing symptoms like infection, a high fever, muscle pain, and skin lesions. After testing the monkey's skin samples, the scientists discovered a new and unique type of pox virus, which they named the Monkeypox virus because it was first identified in a monkey. But the question is, how did it transfer to humans, and why has it taken such a dangerous form almost 7 decades later? The first human case of Mpox was found in a 9-year-old boy from a tribal community in the Democratic Republic of Congo, Africa. The boy and his community, who were in close contact with Mpox-infected monkeys, became a breeding ground for the virus. It was like an experimental laboratory where the virus mutated, adapting to infect humans. One of these mutations resulted in a variation so lethal that it took the life of the child, making just the beginning of the virus's deadly journey. Following this, the virus is spread into 2 major groups or clade. Clade 1, the Congo Basin clade, mainly confined to the Democratic Republic of Congo, and Clade 2, also known as the West African clade. Here's a list of all Mpox outbreaks from 1970 until now, showing which outbreak was caused by which clade. You might think Clade 2 is more dangerous because it has caused most of the outbreaks and is present in many countries including the United States. But this is not the case. Clade 1 shows more severe symptoms compared to Clade 2. Clade 2 on the other hand causes milder symptoms, allowing infected people to travel more easily without being detected. Due to its widespread presence, our immune systems have learned to fight the Clade 2 virus. However, Clade 1 originating from the Democratic Republic of Congo is still considered deadly, and our immune systems are not equipped to fight it effectively. This is why the case fatality rate of Clade 2 is only 1%, while the case fatality rate of Clade 1 is 10%, meaning 1 in 10 people infected with this variant will definitely die. But the problem is the current outbreak is caused by Clade 1, not Clade 2. Experts say that virus can also survive on non-lit surfaces such as curtains, in dark rooms, and in low humidity environments. Cases have been reported in every state in the United States, with Washington DC having the highest Mpox rate in the country. Since May, the US has reported more than 29,000 cases and the total exceeds 80,000 cases worldwide. In the last 3 weeks, California, Illinois, and New York have declared emergencies over the continued spread of Mpox. In fiscal year 2023, the United States allocated more than $2.65 billion in bilateral health funding to countries in Central and Eastern Africa and remains the largest global health donor. Since March 2024, USAID and the CDC have provided an additional $20 million to support Clade 1 Mpox response efforts in the Central and Eastern Africa. On August 20th, the USAID announced up to an additional $35 million in emergency health assistance. The WHO has issued several guidelines to prevent the spread of Mpox, which is as follows: maintain personal hygiene, sanitize shared items, avoid public places and close contact with others, and refrain from touching stray animals. If you find yourself infected with Mpox, isolate yourself immediately and avoid social contact until all rashes have dried up and healthy skin has developed. If you're being intimate, practice safe sex to protect your partner. This helps prevent the virus from spreading to others. Thanks for watching this video. I'll see you in the next one.